So Betsy asked me to talk about the whole process of switching a balloon pump patient from the sending facility over to our balloon pump. We're going to use the Arrow for this one, but this could be applied to any switching between any pump, whether it be Arrow or Datascope. The little Arrow, the big or the little Datascope, the big Datascope, or the Arrows. So first thing you want to make sure that you do is you want to get your report. You want to get balloon size and make sure that they've checked balloon placement either with a chest x-ray or under fluoro. Most, I would say, over 60% of the balloon pumps that we've done recently have been out of the cath lab, so they've just checked it with fluoro. And you want to look at the groin for the site, and we don't actually have I got a line in, but I don't actually have a site for you. But you want to make sure your site's clean, dry, and intact, and that you don't have a lot of swelling or bleeding around there. And then the depth of the balloon, you'll be able to see that on the balloon. And you want to make sure that you are sutured in, either stapled, sutured, some kind of stat lock, some kind of securing device. 99% of them are going to be sutured in these days. They're going to be running through an introducer that's sutured, and then they'll suture the actual balloon pump line in. So you're going to have one drive line coming out that has off the side of it your A-line setup. So you've got your center lumen that's your A-line setup, and it comes off and connects right there at the side. And then you've got your drive line that's coming off. And 95% of the time they're running down the leg and they're at the base of the patient. They're off at their feet. We're going to change it over there, but then we're going to move the balloon pump up off the left shoulder for loading purposes. You want to make sure you look at whichever balloon pump you're taking them off of at the sending facility, and you want to verify your waveforms, verify your augmentations. Lately I've just been taking my phone out of my pocket and snapping a picture so that I can go back when I'm charting and say this is what we picked them up at, their augmented diastolic and systolics, their augmentation pressures, what their waveform looked like, what their timing looked like, and all of that. So the first step is once you are satisfied with your assessment of the patient, which is going to also include, I forgot to mention, you want to make sure you get distal pulses. So that pulse in that lower leg to make sure that it hasn't occluded the blood flow to the leg. Most of the time it's going to be in your right leg. So you want to check for your DP and PT pulses in that leg. And then you also want to check radial pulses in that side to make sure it hasn't, the balloon, or in the left side to make sure that your balloon hasn't migrated up and occluded the subclavians feeding that left upper extremity. And then if you can, make sure you're noting urine output, because it can migrate. If the balloon's migrated down, it'll occlude your renals and it'll shut off blood flow to the kidneys. So you get your assessment taken care of. The next thing you want to be doing is you're going to get your EKG leads from your balloon pump placed on the patient in preparation for transferring everything over. So you're going to take your EKG leads, and we always package off the left shoulder because if you think about it in the 135, when you load the patient, the balloon pump's going to be sitting pretty much right off their left shoulder. So what I'll do is I'll lay my leads off the left shoulder, lay them right in the center of the chest, and then we'll get some EKG leads here. So what I'll do is I'll take the EKG leads and I'll put our leads right next to their leads from their balloon pump. Typically the Datascope leads are bright ass orange. So you want to sit it right next to them. Go ahead and transfer them all over. And then what I'll do, both so that I know which leads are ours when we go to transfer at the receiving facility, and so that I don't pull the wrong leads off, even though they're typically orange, is I'll take some tape and I'll run them over top of our leads. Because once again, it triggers to me that these are our leads, and it also it keeps the leads on, because this is what we're going to be using for our trigger. So you want to make sure that these leads are nice and secured. All right, so you got your EKG leads over. You want to go ahead and bring your pump up alongside the patient. Go ahead and turn it on. Let it spin up. So you've got your leads running up off the left shoulder, and your sending facility balloon pump is typically at the feet. I go ahead and leave it down there and put our balloon pump next to it on the left side of the patient. We got our EKG leads on. We're gonna go ahead and attach that with an EKG source. So now you've got an EKG source on both pumps. We're going to go ahead and transfer at this point. Once we get a good waveform and we know we got a good secure waveform, we're going to go ahead at this point and transfer the balloon over, because you've got a triggering source on your balloon pump. So like we talked about in the previous video, we're going to take this out of the Datascope balloon, out of the front, go ahead and have the sending facility put their pump into standby, and you're going to come across, and so we're going to take, and we're going to have the 40cc key already in our, either the 40 or the 50, depending on which key you need, already in your balloon pump. You're going to take your Datascope line, or it's going to most likely be a Datascope line if you're having to use a key. If not, you're just going to take it out of the Aero balloon pump and bring it over. You're going to add it to your key here. Then I have to switch over to our trainer here, and then we're going to hit start, and we're going to start to pump. And we're pumping off the EKG source. So at this point, you're not going to have an AP source, because we haven't switched over the A line from the sending facility's balloon pump. But you let it get it going and make sure that you're good, and you're getting good augmentation and good pumping off of it. And you're not going to actually be able to look at your augmentation, but you should be able to look at the fact that your pumping is hitting. You can see where the peak of your balloon waveform hits pretty much right between your QRS complexes. Okay, so now we're on our balloon pump. We're pumping on our balloon pump, but we still have our AP source on the other one. So we've got the balloon pump switched over now. We're triggering on our balloon pump on an EKG source, and now we need to change over the AP source. We need to get the A line switched over. So I'm assuming that the A line is already in whatever format your cable is. So for us, it's the oval. So you go ahead and connect it up you disconnect theirs and connect your line. Go ahead and get it connected to your balloon pump. Get your transducer positioned. Go ahead and move your transducer over. Get it. Typically, we'll tape it to their left arm at that feeble static access, or the left chest. Then come back over to your balloon pump. Have your partner open up the stopcock like you're zeroing any other A-line, and with ours, we go ahead and hit the AP select. There's a 0. It'll say 0 transducer. If we're on the transducer, I'm going to go back to monitor because we're using the trainer, but it's in the same spot. You go ahead and 0 it. It'll 0 out. It'll say atrial pressure 0'd. You flip the stopcock back like you do with every other A-line, and then you should get an AP source. So then you get your AP source. And you want to check your augmentations and check that you're getting a good waveform at this point. This is when you would flip to a 1 to 2, and check your timing. And print out like we talked about during the previous video. Go back to 1 to 1 because that's where we want to keep our patients. At this point, you're completely switched over to your balloon pump. You can have the sending facility take their balloon pump, turn their balloon pump off and move it away and get it out of your way so you can finish packaging your patient. Of note, when you package your patient, typically what we'll do is they always run the balloon pump off the legs in the sending facility. This will be up here. What we'll do is we'll come down and we'll create a strand relief just as a safety precaution. In case this gets pulled on, I've got a little give. So I'll pull that down and go ahead and tape it there. Create that strand relief. Go ahead and tape that in just as a safety precaution. And then you want to run your balloon pump and everything up off that left hip. And you're doing the same, your A-line cable will come off and then go back up to your transducer that you taped to the arm. So I typically will try and run everything off the left hip, or the left hip and left shoulder, up off the left side. We'll run the balloon pump along that side going up to the aircraft. Depending on what's going on with your patient, depending on how dependent they are on the balloon pump, you can do one of two things. You either can disconnect your balloon pump at the back of the aircraft, have your partner and some help you get the balloon pump into the aircraft and into the seat in the 135, and then you slide your patient in and reconnect. Or you can follow your patient. That's another reason for this whole left-sided packaging, is you can have the patient follow the balloon pump in through the clamshells and into the seat. It requires a little more help and a few more people, and that should be something that, this is not something you and your partner are doing, you and your partner or even the pilot. It's typically going to be something that you're doing with some help from the hospital, and recruit as much help as you can, because the more security guards and nursing staff and cath lab techs and hands that you can get, the more people you're going to have to help move things around. When you get to the sending facility, you want to make sure that you help the sending facility staff unpackage your patient. You know how you packaged, you want to help them unpackage.